Under the Speaker's announced policy of January 9th, 2023, the gentlewoman from Vermont, Ms. Ballant, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker. Tonight, my colleagues and I are here on the floor of the U.S. Congress to talk about the mental health crisis we're seeing across the country in each of our congressional districts. I know this issue can be incredibly hard for many people to talk about. It's personal, it's complex, and many Americans don't feel comfortable talking about it because they fear the reaction from their friends, their families, or coworkers. But seeking mental health treatment is not a sign of weakness. It means you're human. The body does not stop at the neck, and mental health care is health care, period. All of us here tonight are fighting for a future in which anyone who wants mental health care gets it, when we finally end the unequal treatment of mental health. Mr. Speaker, I yield to the gentlewoman from Michigan, Ms. Tlaib.
Thank you so much to my good colleague from Vermont. As you can see, even behind her, it says, facing mental health challenges doesn't make you weak, it makes you human. Even as I say this, I think about Damon in my community who took his life. He was a veteran. He served our country, came home. He continued his service by being one of our firefighters. When I read that every single day in our country, in our nation, about 17 veterans die by suicide, I was shocked. That's 17 families, Mr. Speaker, whose lives will never be the same. This is just one of the heartbreaking effects of war and the reality of the mental health crisis in our nation. We must work harder than ever to ensure that no person, no human being or veteran is left behind, and everyone receives the mental health support and love that they need to survive. The forever wars of the past decades have left behind immense trauma, and far too often our government fails to provide our veterans with the support they need and deserve. If we cannot provide the necessary mental health care and support of our veterans when they return home, we should not be sending them to war. This mental health Awareness Month, we must prioritize improving access to mental health services to every single American, every single family across our nation. This is critical to creating a better quality of life for our communities and their families and everyone in our community that continue to struggle. I want to let every veteran know this. In this moment, as you hear me, I hope I can save a life by telling you this. You can call the National Suicide Prevention Lifeline at 988, which offers free confidential support 24 hours a day, 7 days a week for those experiencing mental health crisis or contemplating suicide. And for our veterans looking for care that's designed for the unique challenges facing your community, please know that you can now access the Veterans Crisis Hotline by dialing the 988 number and pressing 1 to get connected. This is important, because on that other line, you may be connected to a veteran who understands how you feel. By shedding light on the realities of the mental health crisis in our nation, we can create an environment where people feel seen, they feel heard and understood. We must break the stigma surrounding mental health challenges and ensure that health care is a human right, not a privilege. If you're a veteran, again, in crisis, a person in crisis, please know that there are people that care deeply about you, and we want to support you. Please reach out for help if you need it. Again, that crisis line is 988. Simply dial 988. And again, from the bottom of my heart, please believe me when I tell you, you are not alone. Thank you, and I yield.
Mr. Speaker, we are in the midst of a nationwide mental health crisis. And it's critically important for all of us in positions of power to do the work of passing legislation and funding programs that will meet the needs of our constituents. It's also important that we use our positions to help create opportunities for connection in our communities right now, because we have a crisis of loneliness and a disconnection in our nation. It has become such an urgent issue that our U.S. Surgeon General, Vivek Murthy, has unveiled a new framework and strategy to address this national crisis of loneliness. Murthy has said that social connections must be a top priority in terms of public health. He believes, as I do, that the epidemic of loneliness and isolation has fueled other problems in our society that are making us very sick. His research shows that about 1 in every 2 Americans is experiencing loneliness at any given time. It's shocking. And it isn't just emotionally uncomfortable to be lonely. It also has real consequences on our health. It can increase the risk of anxiety, depression, heart disease, stroke. And data indicates that the risk of a premature death due to loneliness is even comparable to the risk associated with being a daily smoker. This rampant disconnection and loneliness also fuels anger and distrust, and it adds to the disconnection that many Americans experience. The science is clear and compelling. Research has found that our need for connection may be as fundamental as our need for food and water. Many studies over the past decade have come to the same conclusion. Social connectedness generates a positive feedback loop of social, emotional, and actually physical well-being. People who feel more connected to others show levels of anxiety and depression. People who feel more connected to others show lower levels of anxiety and depression and greater empathy for others. They also tend to be more cooperative and trusting. And a lack of social connection can have a range of negative effects. One study of 7,000 Americans of different ages, genders, and health found that people who were disconnected from others were roughly 3 times more likely to die over that 9-year study than people with strong social ties. And surprisingly, regardless of demographics, people who had unhealthy lifestyles but close social ties lived longer than those with healthy living habits but poor social connections. Not only are relationships fundamental to our health and happiness, but research shows that they may even shape how our brains work to make decisions. We must craft policy and make investments to address our national mental health crisis. At this time, Mr. Speaker, I yield to the gentlewoman from California, Ms. Kamlager-Dove.
Thank you, Mr. Speaker, and thank you to my colleague from Vermont for hosting this special order hour on mental health. So long before I came to Congress, when I served on the board of the Los Angeles Community College, we would hold monthly board meetings throughout the district, and it's the largest community college district in the country. We had 9 campuses, and so we would visit them regularly. These meetings were oftentimes very long. They were open to the public, and lots of people would come. Lots of people, lots of characters, and lots of mental wellness issues were often on display. So the Los Angeles County Sheriff's Department was contracted with the district, and it was the Sheriff's Department that would provide security for these meetings. And I would watch these officers, mostly men, but I would keep my eye on them to see how they were doing. And I would watch them take into account the changing surroundings based on the meeting and the topics, and adapt to the circumstances of the evening. And on occasion, these men, these good men, would have to manage a mental health episode by an attendee of the meetings. A mental health episode that verged on the unsafe. And I have to tell you, these sheriffs were not trained for that. To become a sheriff to do that kind of work. And in reality, they should not have been doing that. And yet, we dump more and more social, economic, mental, and physical health care issues on their plate. We are asking ill-equipped law enforcement members to be responsible for managing the mental health crises of our communities. No wonder they are under duress. Police officers report higher rates of depression. 30% of responders develop some kind of behavioral health condition, compared to 20% of the general public. Law enforcement officers have a 54% increase in suicide risk when compared to the civilian population. And correctional officers in our prisons have suicide rates much higher than other law enforcement agencies or even the military. And yet Republicans want to crack down on mental unwellness in every instance except in cases regarding fentanyl. And I wonder why that's the case. But by bolstering the institutional policy status quo, you're not helping the mental health of our officers or those that they interact with. I am actually floored that Republicans have the audacity to talk about supporting police when they have done nothing but put these folks more in danger. For the past 2 years, House Republicans have closed the Labor, Health, and Human Services account for community project funding requests, obstructing funding from flowing into our districts to support those struggling with mental health. House Republicans also barred nonprofits from applying for community project funding within the Community Development Fund Economic Development Initiative for HUD, preventing organizations that specialize in addressing homelessness from receiving vital federal funding and placing additional burdens on law enforcement. It is hypocritical to say this is Police Week and you want to support law enforcement when you vehemently oppose to funding, supporting, or uplifting any of the initiatives that actually would do the most to help police, including their mental health and including the mental health of those they interact with. So instead, let's commit to legislation like H.R. 6202, the Counseling Not Criminalization in Schools Act. This legislation diverts federal funding away from supporting the presence of police in schools and toward evidence-based and trauma-informed services that address the needs of marginalized students and improve academic outcomes. I have to tell you, the most common reasons why police officers are called are for issues related to parking, noise nuisance, poverty, domestic violence, and mental health episodes. And none of these, truthfully, require police intervention. Most demand mental health intervention, especially when you're dealing with someone in crisis. By investing in mental health crisis intervention initiatives, we can actually better ensure the safety of both our communities and law enforcement. Now, I generally don't like to talk about another state or somebody else's district, but I want to share a little bit about what's been happening in Oregon. In Eugene, Oregon, they instituted this initiative called CAHOOTS, Crisis Assistance Helping Out on the Streets, a program with the city's police department, and it has had resounding success. For nearly 30 years, the program has dispatched crisis response professionals to assist people who are intoxicated, mentally ill, and/or disoriented, to assist the responding officers, reducing police service calls by almost 9% every year. It's also cut down on workers' compensation issues and other liability claims. This program actually inspired me to introduce and pass into law the Crisis Act in the California State Legislature, which established a pilot grant program to support similar community organizations that provide stability, safety, and culturally informed and appropriate responses to mental health crises, to people experiencing homelessness, to challenges with domestic violence, and also to natural disasters. And law enforcement was supportive of this because they don't want to take mental health crisis calls. But I don't know if Republicans care about them or about this country's mental wellness, because they are certainly unwilling to support policy changes and crucial investments at the federal level that would address mental health crises and mental health episodes. So, in closing, I'm going to think back to my time in the California State Legislature, working with the California Department of Corrections and Rehabilitation, and listening to stories of correctional officers battling depression, battling alcoholism, feeling isolated, being abused by other correctional officers, and being afraid to talk about it. I think about the conversations I had with parents of correctional officers who died by suicide at their job. All of these examples are examples of a mental health crisis happening in our homes, happening in our streets, happening in our facilities, where we are asking folks to show up every day of sound mind and work on behalf of a locality or a country or a community to help keep it safe. And we are not even doing our part. Republicans are not even doing their part to help them be safe. I hope that Republicans are done playing hooky at a courthouse in New York today and will come back here and focus on this immediate, on this critical, on this important epidemic that has taken hold of the very people they claim to support. And with that, I yield back.
Thank you. Mr. Speaker, at this time, I yield to the gentlewoman from Hawaii, Ms. Takuda.
Thank you, Mr. Speaker. 9 months ago, the Lahaina fires took the lives of 101 people and destroyed hundreds of structures, including homes, classrooms, historic parks and features, and businesses. And while we've come a long way to repair the physical damage inflicted upon our community, the trauma and emotional pain from the fires continues to take root in the lives of our Maui ohana. First responders and disaster workers and volunteers are on the front lines and have been there from day one, delivering physical and emotional support to our people and families during this time of crisis. And while we know they often, and you've heard this from the previous speaker, while they often put the needs of others before themselves, the reality is they too need help dealing with the challenges and the dangers that come with the experiences and the things that they see every day on the job, the situations that they are faced with. I'll digress a bit and tell you some stories of things that I saw in the first days, weeks, and even months after the fires. It was not uncommon for me to come across even some of the top brass and leadership of our emergency management or our fire department or our police department, and they would stop me. And you could see by the look in their eyes that it was very hard for them to continue as they talked about the things they saw, as they talked about the experiences that they went through as victims and survivors themselves, and many of them asking me, how can I go on? What do I do now? I need help too. Statistically, sadly, we know that police officers and firefighters, first responders, find themselves in this very situation time and time again. We know that these first responders are more likely to die from suicide than in the line of duty, and that depression and PTSD are up to 5 times more common in first responders. Unfortunately, there are only a limited number of services and resources available specifically to address the mental health needs of our first responders. And too often, first responders are directed to services that fail to meet them where they are at and are inadequate to support their mental health and well-being, to truly understand the situation that they are dealing with every single day, reliving the trauma, reliving the moment that they've experienced, and yet on the surface, having to put up that happy face and continue to serve the public. This is unacceptable. That's why I introduced the Care for First Responders Act, which would make sure first responders and disaster workers and volunteers have immediate access to on-site specialized crisis counseling services and resources. Our bill would also establish a peer support program at a national hotline to provide 24/7 confidential, comprehensive crisis services to first responders and their loved ones. Every day, these brave individuals risk their lives to keep our communities safe. They are our superheroes, but they are still human. All of us need to be there for them, and we must do everything we can to provide all of our survivors and disaster responders with the mental health and support they need now. The reality is, we can clear away the debris. We can rebuild our schools, we can reopen our roads, we can see houses coming up. But healing from the pain and trauma, that's a lot more difficult, and that takes time. As we recognize Mental Health Awareness Month, I want to thank my colleague from Vermont for giving us this opportunity to call attention to the mental health crisis that is ravaging our people right now. I urge my colleagues that while we have made incredible progress to expand access to mental health and substance use disorder, there is still much, much more work to be done, and it must be done now. We must continue to fight to ensure everyone can get the care they need, when they need it, where they are at. We must pass critical life-saving measures like H.R. 6415, our Care for First Responders Act, a truly bipartisan measure with 44 co-sponsors from both sides of the aisle to support those who support and care and protect us every single day. We must prioritize and act with urgency to fund and pass progressive policy changes to support mental health in our community. And for the sake of all of the people that we loved, for every single person, even in this building, we must do it now. Thank you, Mr. Speaker, and I yield back.
Thank you. Mr. Speaker, at this time, I yield to the gentleman from California, Mr. DeSanya.
I want to thank my colleague, my wonderful colleague from Vermont, for yielding and for convening this important conversation. This discussion could not be more timely, Mr. Speaker. Rates of mental health conditions for Americans' children have been rising for years, and now they're rising exponentially. In 2019, 1 in 3 high school students reported persistent feelings of hopelessness and depression, representing a 40% increase over 10 years. Social media has had a profoundly negative impact on mental health, with adolescents who spend more than 3 hours per day on social media facing twice the risk of developing symptoms of depression and anxiety. The youth mental health epidemic in America has also caught the attention of our top public health authorities. Over the last several years, the Surgeon General has issued advisories about youth mental health and the harm caused by social media. Included in the advisories is guidance on how young people, their families, educators, health professionals, tech companies, and other stakeholders can address these challenges by encouraging healthy relationships, modeling good behavior, improving data privacy for children on social media, and more. The CDC has also been involved, including through research about COVID pandemic's negative impact on youth mental health, the isolation. The agency found that during the pandemic, youth experienced a very low rate of social connectedness, understandably, a sense of being cared for, supported, and belonging at school, and that lack of feeling connected to school was associated with nearly 20 percentage point increase in persistent feelings of hopelessness and depression amongst American young people. These statistics obviously are deeply troubling and a warning sign to us here in Congress and to America. We have a responsibility to the future of this country in Congress to support children and families who are struggling. I'm proud to have led legislation like the Early Childhood Mental Health Support Act, which would provide Head Start and early Head Start programs with funding to conduct behavioral health interventions for young American children. I'm proud to say that this bill passed the House last Congress in a bipartisan support in my broader Mental Health Matters Act. But we have to keep pressing on until this bill and other legislation to protect the mental health of young Americans get across the finish line, signed and implemented. We know that failure to address mental health disorders and adverse childhood experiences early on can lead to a lifetime of bigger issues and serious outcomes for the individual and for our country and the community. As we continue our work in Congress to address children's mental health, we must ensure that our efforts meet the critical needs of this moment. Thanks again for convening this, and thank you for leading the effort to raise the consciousness of this epidemic in America.
Thank you. So, Mr. Speaker, we have heard from members from many different parts of the country, from Vermont to Michigan to California to Hawaii. And as I said before, we must prioritize human connection and healthy relationships, and we have to craft policy and make bold investments to address our national mental health crisis. The percentage of U.S. adults who report having been diagnosed with depression at some point in their lifetime has reached nearly 30%. This is almost a 10% percentage point increase since 2015. And the percentage of Americans who currently have or are being treated for depression has also increased to almost 18%. These rates are the highest recorded by Gallup polling since it began measuring depression using the current form of data collection in 2015. It's impacting all of us, but I'm particularly concerned about the toll it's having on our kids and teens. 30 years ago, the greatest health threats to teenagers came from binge drinking, drunk driving, teen pregnancy, and smoking. These have all fallen sharply since then, but they have been surpassed by soaring rates of mental health disorders. In a little over a decade, the number of adolescents reporting depression has increased by 60%. Emergency room visits by adolescents are up as parents seek help for their teens who are struggling with anxiety and depression or self-harm. And suicide rates among adolescents are up sharply as well. The public health crisis has intensified since the pandemic, but it didn't cause it. We've seen a steady increase over the past 20 years. Young people now are getting less sleep, less exercise, and less in-person time with friends, all crucial for physical and mental health. Adolescent brains are being exposed to a huge wave of incoming stimulation via social media and technology. Teens in my district have told me they feel anxious, disconnected, and depressed. Many fear that their constant use of cell phones and social media is impacting their mental health. So we have important work to do, all of us. Every single congressional district is experiencing this. My work on mental health will be a cornerstone of the work that I do in Congress. I'm working towards a future in which anyone who wants mental health care gets it, and when we finally end the unequal treatment of mental health and addiction. Thank you, Mr. Speaker. I yield back.
Under the Speaker's announced policy of January 9th, 2023, the Chair recognizes the gentleman from Alabama, Mr. Moore, for 30 minutes.